You're watching Hope and Courage, a tribute to breast health on ABC 27, presented by Penn State Milton S. Hershey Medical Center.
And we're here with Dr. Rena Cass. Doctor, tell us about the team approach to breast cancer and breast care.
Well, at the Penn State Hershey Breast Center, we believe in a multidisciplinary approach to breast cancer. What does that mean? It means if you come in and you have a new diagnosis of cancer, you're not just seen by me, the breast surgeon, or one of my colleagues. You're seen by an entire team of people, including the medical oncologist, the radiation oncologist, the surgeon, the pathologist, members of the genetics team, if necessary, plastic surgeons, and some of the research teams. And that's done through what we call is our multidisciplinary conference that we have each Thursday, where your case is specifically discussed and we come up with a consensus plan on what's the right treatment for you. It's like having 10 second opinions at once.
And that saves a lot of time, a lot of money, and a lot of worry.
And everyone is on the same page.
Okay, well, thank you. Well, here's another powerful story. Barbara Moore received some unexpected news after she had a mammogram.
Come on, let's dance.
Lots of love and laughter fill Barbara Moore's home, even when times get tough. For Barbara, it was when she had unusual pain in her right breast.
I remember just having that pain there, and it wasn't sharp. It was just a pain that just, if you touch, it hurt.
So she had a mammogram.
On the mammogram, there were several areas that were concerning.
A red flag to doctors, which meant Barbara needed a biopsy.
I remember the doctor saying, don't worry, because 90-something% of these are, nothing to worry about. They're benign.
But that wasn't the case for Barbara. She remembers the day all too well.
Got a call to come in on the 19th of December of 2006, so that's what I did. I went in. Whew. That's the heart.
Every woman's worst fear, breast cancer.
A nurse came in, and she just took my hand and sat there with me and held my hand, and she said, you need to see someone right away.
Radiologist Dr. Susan Shetter discussed Barbara's diagnosis with breast surgeon Dr. Rena Cass.
This is the original site of the biopsy, and we know that this is positive for cancer. When we look at another level in the breast, I've got this area that is abnormal. The shape of this is very suspicious for more cancer and yet another site in front.
Barbara had 4 areas of breast cancer, which left her with only one option.
She really needed a mastectomy to try to remove all of the breast tissue in all of those areas of breast cancer.
There was no hesitation. Barbara scheduled the surgery immediately with her husband, 4 children, 10 grandchildren, 1 great-grandchild, and her mother by her side.
This was scary. It's scary because you're thinking, what's going to happen with me? Where do I stand within this, range of things?
Barbara's fight was not over. Chemotherapy was next, 4 months of it. Like most patients, she knew what was going to happen to her hair.
I said to my husband, go get your clippers. And he said, what? I said, go get the clippers. He said, for what? I said, because you're going to shave my head.
Next came radiation, 7 weeks of it.
Radiation just left me tired, exhausted, on with the chemo, because that, it's still in your body, and you're feeling very tired, no energy.
She received both chemotherapy and radiation because it was felt as a result of our group conference where all of our specialists meet that she would benefit from both therapies to reduce the risk of her recurrence and to promote better survival.
Dr. Cass says Barbara is cancer-free.
May you see the beauty and joy in your life as you continue to grow stronger with each day.
Faith, family, and friends together pull Barbara step by step through this difficult time.
I do see myself as one that has survived, can survive, will survive, and go on surviving.
Well, Dr. Cass, when a patient has a breast removed, do they usually have reconstructive surgery? following that?
They can, and there are two general types of reconstructive surgery, either putting an implant in or moving some of their own tissue from their abdomen or their back into place. But the person that's best able to determine what type of reconstruction the patient is best suited for would be the plastic surgeon. We are fortunate at Penn State Hershey Breast Center to have wonderful plastic surgeons as part of our team, and they help make that decision along with the patient.
Big decision. Thank you, doctor, for joining us
You're
tonight.
welcome. It was my pleasure.
And we'll be right back.